Now I'm going to discuss about the risk factor of stroke. So when it comes to the risk factor of this of stroke, what I'm going to discuss is primarily what are the risk factor for arterial stroke. So these risk factors mainly apply for the arterial stroke. For venous strokes, there are different risk factors. Mainly coagulation abnormality causes venous stroke. We are not going into that because arterial stroke is by far the most common. Now, when it comes to the risk factor for the arterial stroke, it also depends on whether the stroke is ischemic or hemorrhagic in nature. And depending on the type of arterial stroke, the risk factors are different. The common risk factor for ischemic stroke are the following. Number one is hypertension. It is one of the most important risk factor for ischemic stroke. Number two is atrial fibrillation, and this is one of the most important risk factor. Not only it is one of the most important risk factor for large stroke caused by atrial fibrillation is usually more severe. They have got poor prognosis. It's because the volume of thrombus in atrial fibrillation is much more than the other type of stroke. The third important risk factor for which can contribute to stroke is smoking. Fourth is diabetes mellitus, and subsequently all the other risk factor for atherosclerosis would come as the risk factor for ischemic stroke. So for example, hyperlipidemia, old age, male sex, obesity, sedentary lifestyle, poor eating habit, etc. All this will come as a risk factor for ischemic stroke. Now, it is important to note here that hyperlipidemia is not in first four, although in cardiovascular disease, hyperlipidemia is much higher up in the list. In case of cerebrovascular disease, it's a risk factor, but it's not as high as the other four mentioned. So, these are the common risk factor for the ischemic stroke. Now, when it comes to hemorrhagic stroke, again, the number one is hypertension. Number two is cerebral amyloid angiopathy. So in other words, it's amyloid deposition in the medial layer of cerebral blood vessels. So it's called cerebral angiopathy. Number three is drugs, for example, antiplatelet and anticoagulant. And last but not the least, number four is aneurysm or AV malformation. So these are the most important risk factor for arterial stroke. For ischemic stroke, number one hypertension, number two atrial fibrillation, number three smoking, number four diabetes mellitus, and then all the other risk factor for atherosclerosis will come into the risk factor for ischemic stroke. There are also other relatively less common cause of ischemic stroke, for example, arterial dissection, for example, inherited coagulation disorder, for example, various inflammatory disorder of the cerebral blood vessels, either due to autoimmune process or infection, or various congenital condition like CADASIL, etc. will come. But the most common are these four. When it comes to the hemorrhagic stroke, these are the hypertension, cerebral amyloid angiopathy, antiplatelet, anticoagulation drugs, and aneurysm and AV malformation are important. Venous stroke, the risk factors are quite different, but just to tell briefly, most common risk factor for venous stroke is, for example, pregnancy, puerperium, and congenital or inherited coagulation disorder and cancer. These are the most common risk factor for venous stroke. Thank you very much.